Hey, Dr. Serendipity here. Thanks for following in. We're going to do chapter 4 of A Medical Apartheid, which is titled The Surgical Theater. First story I want to talk about here is about a man named Sam, who's 42 years old in about 1838, who was having some jaw pain. Around 1845, he was basically just worthless in the fields, and that same Dr. Sims we talked about previously was called in for a consult. He determined that this man could only undergo a surgical procedure. I believe they thought he had osteosarcoma, so bone cancer essentially. But of course, since he was a slave, it's not like it was his choice. It was the master's choice, and decided, yes, let's go ahead with this treatment, even though it's not what Sam wanted. Basically, when they met, Sam was invited to sit down into a chair by Dr. Sims. Then 5 young physicians restrained him to this chair while he was immobilized, and this was in front of several other medical students and probably other physicians. Dr. Sims operated for 40 minutes to remove a large section of Sam's lower jawbone without anesthesia. Later, this so-called surgery, or torture, as far as I'm concerned, was reported in the New Orleans Medical and Surgical Journal, and they said, they were pleased to record this highly credible achievement of a Southern surgeon. Later, Dr. Sims made a medical report, which he made sort of a parting shot, you would call it, at Sam when he said that Sam's mouth is always open in a wide grin. There's another report of a Dr. T. Stillman who ran serial advertisements about his infirmary, and basically was just buying slaves so he could start doing experiments and trying different kinds of medications and things. And obviously the slaves had no choice in this. All of this experimentation was kind of at a time where hospitals were much less of an institution of healing, and they're much more about physician-centered learning, training, and experimental approaches. And of course, most of these were conducted on black people and other poor people. So whites were included in this, but definitely heavily favored on blacks. The slaves were basically referred to as clinical material, and there was often a lot of speculation about their sexuality, which was a big part of it. In fact, in August 1846, a medical student at the University of Michigan expressed surprise that a 16-year-old black girl whose body was undergoing dissection had died a virgin. In 1855, Virginia Medical and Surgical article proclaimed that a 24-year-old slave with bladder stones is, quote, is reported to be a great buck among dark damsels. Also during this time where hospitals were, really talking about this experiment and physician-centered stuff, medical school is considered a selling point when they had plenty of low-income patients for students and residents to see. Of course, that's also something that kind of goes on today with residencies as well. At one of these medical school clinics, a slave master sent his slave there to get treated for a stubborn leg ulcer. The surgeon decided to amputate the leg, surrounded by a bunch of students. The slave complained that his leg was cut off just to let students see the operation and to bring the doctor, as well as the medical college, into notice. There's another example of a 15-year-old slave girl. The surgeon who amputated her leg, the surgeon told his students flatly that the decision to amputate should be weighed differently according to the person's race and class. Amputation should be very differently estimated in different classes of society. He explained that although such extreme remedy is a horrid deformity, that should be the last resort for a rich man. And one more final example here was when a South Carolina youth fell from a tree, injuring his genitals. The attending surgeon administered chloroform, knocking him unconscious, repaired the minor injury, and then after the successful repair, the physician decided to remove the boy's testicle. But he told the boy that only the injury had been sewn up. A week had gone by before the boy became aware of the loss of part of his body. The surgeon recorded his achievement in an article entitled Chloroform, Its Effects in a Case of Castration, that he just simply decided to do on his own without asking at all. One quick last thing before we close. 1849, a black woman gave birth to twins, one black, one pale. The first assumption was that she'd done something wrong. She'd been with more than one man, a white man and a black man. This was 1849, but the same assumption just happened to me and my wife in the past couple of days on a video that I posted on Reels that has gone viral for like 2 million views so far. Take a look, see what you think.